drive, I'm on the same drive. No more doubts, I'm feeling alive. With every mile I leave the past behind, same drive. This is my state of
Hello, everyone, and welcome to another episode of Sanity Drive Podcast. In celebrating the Mental Health Awareness Month, Sanity Drive, in collaboration with Women Leading Change and Public Health in Real Life, is hosting a talk on pediatric mental health, bridging the gap for healthier generation. This is an often less talked about topic, and much attention is not paid to the pediatric mental wellness. This episode is therefore aimed at creating awareness about the essentiality of pediatric mental well-being by raising awareness about the maternal neonate crosstalks and developmental programming that are capable of shaping life experiences, behavioral responses, and brain functions in later life. We aim to foster a foundation for healthier, more resilient, and psychologically sound minds in generations to come. Briefly, Women Leading Change seeks to improve gender-balanced leadership in global health, and Public Health in Real Life is committed to educating the next generation and also celebrating heroes in public health space. This episode has been benchmarked on a shared vision of the three groups towards creating a world where mental health is prioritized, supported, and destigmatized for all, including our youngest members of the society. So we are not leaving anyone out. Thank you again for joining us. My name is Nsarami Abe, and I'll be hosting this discussion. And joining me for this very critical topic is a renowned expert in global health and pediatric care. She is no other person but Dr. Memunat Alex Adeomi, who is a physician with global health experience, passionate about what she does, and she brings medicine closer to the reach of people as much as she can in practicality. She is the current director of global training and implementation at the American Academy of Pediatrics and the former director of education and training at Operation Smile. Memunat has also worked as Director of Clinical Affairs at Sanford Health. I can go on Memunat's profile, but I must say this, that Memunat is one of the great women at the forefront of global health training sector, promoting health equity as much as she can with passion. Thank you so much, Memunat, for all you do, and thank you for taking out time out of your very busy schedule to join us on this call today.
Thank you so much, Nusa, for having me.
Yeah, so just as I mentioned earlier, we want to look at the link between maternal and child health and mental well-being. So looking through this lens, Memunat, can you share your perspective on the interconnectedness between maternal newborn health and mental health?
Yeah, thank you. And that's a great question, Nusa. So the thing is, the relationship between maternal and newborn health and its impact on pediatric health later in life is profound and really multifaceted. It's reported by the World Health Organization that over 15% of pregnant women would experience mental health issues. The most primary or most common one of this is depression. And then during pregnancy and childbirth, the women and even families in general experience significant physical, emotional, and hormonal changes, which then impact mental health and well-being. And these perinatal mental health conditions that I mentioned before, which include depression, anxiety, are so common, especially in developing countries, and the fact that due to cultural practices, stigma, lack of awareness, these often go unrecognized or untreated, even further making those conditions more dire. So the idea is that one has to be more mindful of these conditions, because these then in turn affect infant physical health and then also affect children's physical and mental health. Studies have shown that the impact of a mother's mental health during pregnancy shapes a child's mental health even when they get to youth and adolescent ages.
Thank you, Memunat. Those were great points there. Touching from your wealth of experience from global health, I want us to go deeper and looking at some of the specific mechanisms that may underlie this interplay, some of those perinatal mental health conditions that you mentioned earlier.
Yes, like previously mentioned, there's a growing body of scientific evidence that highlights that profound impact between a mother's mental health and the child's mental health and well-being, even up to youth and adolescent ages. And one of the primary mechanisms that has been pointed out is that during pregnancy, there is an increase in stress hormones, and in this case, cortisol. And these tend to cross the placental barrier and then can affect the fetus. And this is even at a higher level when the mother's maternal health is at risk or she's experiencing maternal health issues. And then because of the impact of high levels of cortisol with the fetus, this is associated with an increased risk of premature birth, low birth weight, and potentially developmental delays in children. So this is from a physiological standpoint. Then postpartum depression, which is very common, that mother-child bond and attachment, which plays a crucial role in an infant's physical, mental, and emotional well-being, is lost during that process just because the mother is not in the right state of mind to care for herself. And in this case, sometimes mothers can be so extremely depressed to the point of suicide, so the families would have to intervene and separate the mother from the baby. Again, losing that period of attachment that helps with mental and emotional well-being. And then this can continue up until beyond the infant stages, where the mother is not able to maybe even feed, which would help with nutrition, coping with stress, help with knowing sense of self, and then sometimes also if the mother is on medications, those could also affect.
Thank you again, Maimunat. You mentioned something around the stressor hormones and some of the exposures that the mother may have and the impact on the child. That was quite explicit, and you were able to create this interconnectedness. But I want us to go into the specific examples of some of these consequences, what the manifestations could be like, the crosstalk between maternal and mental health of the child from a holistic point of view.
Absolutely. I think as we go beyond infancy stages and talk about like beyond the first 5 years, once a child has been affected psychologically or emotionally, studies have shown that children of mothers who had postpartum depression, especially if it was left untreated, would usually likely exhibit symptoms of anxiety, depression, and behavioral problems, such as aggression, attention deficit hyperactivity disorders, and then just attention deficit in general. These children would also often experience delays in cognitive development for various reasons that were previously mentioned, delays in language acquisitions, which would help them integrate with peers, which would then further exacerbate the mental health issues, and then also difficulty in forming relationships, social bonds, and exhibiting social skills within group settings or with their peers or in formal settings. Furthermore, the impact, like we said, extends beyond childhood to adolescence. It's said that up to 10 to 16% of youth today are experiencing one form of mental health disturbance or the other. And if you trace back to the root causes, this is also tied in with increased maternal health issues. And then so what then happens is that increase at the developmental stages is also leading to a higher risk of developing those mental health disorders later in life, further perpetuating that cycle of intergenerational transmission of mental health challenges. There's still some studies ongoing about potential genetic implications of this. That could it be that children of women with mental health issues are predisposed to mental health issues just purely from genetics, or again from those environmental factors and social determinants of health like we mentioned.
So I like the fact that you touched on both the environmental and genetic things that could be responsible for some of those consequences that we're seeing and how they kind of associate. So going further, you have been a global health expert and you've been in this field trying to promote health equity. Are there some strategies that we could put in place or recommend based on your own experiences to minimize some of those risks early in life for the pediatric?
Yes, and that's a great question. I think when we talk about solutions, mitigation strategies, addressing challenges, it really requires a multifaceted approach. And like we mentioned, really delving into the root cause, which would then include and involve prevention of mental health issues, early identification and intervention when they occur, and then providing ongoing support, because that is key to addressing any mental health needs. First, we have to prioritize maternal mental health screening and support services. And usually they would say because it's maternal at the point of pregnancy and the postpartum period. but I would even dare say going far back in the pipeline. When people are intending to have children, people should start being counseled and screened about potential risks for mental health. So that should be part of the questionnaires that are included in that stage, is understand if there are any underlying predisposing factors, so that the index of suspicion is high when the mother then in turn becomes pregnant, or the couple becomes pregnant. So that would be important. And then we had mentioned previously that the higher incidence of this is in developing countries, but even here in the US and other developed nations, there is still a high burden of mental health. And this also involves the fact that you don't have enough trained personnel who would support mothers and children and infants in order to, again, identify those mental health issues and then intervene early. The late Dr. Paul Farmer, who is known as the father of global health, mentioned the building blocks of the health system, and he used the 4S framework. And the 4S's stands for staff, stuff, space, and systems. So I'd like to use that framework for talking about how to address challenges with mental health issues, especially with inequities that persist. Is you need the right staff. Trained mental health providers who also understand the cultural context and nuances, because culture, religion, practice, and all of that play a huge role in how mental health is perceived within communities, and then how to intervene and then get community and family support. Then we talk about the stuff, the tools and the resources to not just diagnose, but treat. In a country like Nigeria, it's said that you have a little less than 200 psychiatrists for a population of over 200 million people. So let's say you then in turn address that gap in skilled workers through task shifting, task sharing, and you have enough providers. People don't have access to some of the newer medications on the market, or some of the tools and resources to do cognitive behavioral therapy, or some of those non-pharmaceutical interventions. So that's the second thing. The space. Because of the stigma associated with mental health, and then just the fact that mental health will need to be addressed in a bit more nuanced and unique fashion, you have to design spaces that would allow for safety, culturally appropriate and contextualized healthcare and access to services for, again, in this point, we're talking about maternal and child health, but for the entire community at large, and then also for providers to be able to provide intervention in different settings. And then the last S is systems. The referral systems for when you identify the long-term support. Maternal health issues are not like other issues where, yes, you give a medication or you do a surgery and the person just comes for follow-up. A lot of times is long-term follow-up. So how are we designing systems at the facility level, at the community level, at the societal level that would support continuous intervention, especially as we talk about that continuum of care and the life course approach from maternal, newborn, infant, child health to adolescent health. And I'll stop right there just because there's a lot, but basically it's taking this very holistic, family-centered, social determinants of broad health systems approach to addressing the challenges with the maternal health issues and maternal health outcomes.
Wow, thank you. That is really great. And I'm happy that you're churning out things from your wealth of experience, talking about the staff, stuff, space, and system. That's great. So these things that you mentioned were quite critical. And from your own experience, I know that you know that there are certain challenges, and I think you pointed out some of those things from responding to the previous questions, but I want you to go a bit deeper, looking at the vulnerability of different communities and particularly the underserved communities. What are some of the challenges and how can this be faced? Go ahead.
Yeah, I think especially when we talk about vulnerable populations and underserved communities, one of the biggest challenges that persists is that stigma around mental health issues. And these are often compounded by cultural beliefs, misconceptions, misinformation, and then just the lack of awareness of what to expect. So in many communities, we talked about that lack of awareness and even understanding about those perinatal mental health conditions. So a mother just gives birth. In so many cultures that we have there's a lot of family around, or maybe not, she's still expected to do some work, or she has help. And then there are all these cultural practices and expectations. And what then happens is there's a lot of attention and emphasis on the baby and nothing on the mother, or she gets lost in that milieu, and then people do not easily identify that something is amiss. Or if the woman then is saying, look, this doesn't feel right, because of that stigma again, everybody is expecting, oh, brand new mother celebration and all that, but the mother is struggling emotionally and psychologically, and she cannot voice it out, because it's like, even when she does, she's either dismissed, or he said, oh, don't worry, it's just a phase, or it's passing, there is nothing like that. Then she's not able to seek and ask for help. So at that point is, we have to, again, as we talked about, that awareness and sensitization, even before people are beginning to think of having kids, go to as far back as secondary schools. As you are talking about sexual and reproductive health, begin to talk about mental health issues and what to expect and how to identify that. So that would be that main thing. And then also the fact that a lot of mental health interventions now are policies and guidelines and evidence-based medicine that is mostly generated from high-income settings. And a lot of those things will not necessarily work in low and middle income countries or in certain cultural contexts. So then the treatment options, the diagnostic options have to be contextualized. How do you even ask a question around mental health? There would be some languages where even mental health as two words, you don't have any way to describe it or define it. So how do you then diagnose it in that cultural context? So it's being able to contextualize and adapt the tools and resources that would help you to identify it, and then to then provide culturally appropriate care. I think that would be something that has to be embedded within any intervention, any treatment and all that in underserved and vulnerable communities.
Excellent strategies there, Memuna. Thank you so much for those very deep points you made. So as we wrap up, from your respected office and also as a woman at the forefront of global health, and in your own capacity, what are some of the message of hope that you could send out to our listeners today, particularly women or those who are struggling with maternal child mental health challenges?
First of all, Nusa, thank you for having me on this podcast, because I believe this is one of those avenues where we are highlighting mental health issues, strategies to combat them. But I would say, in a message of hope and encouragement, I would want to highlight some of the things we mentioned. First of all, even though we talk about lack of awareness in underserved communities, on the flip side, May being Mental Health Awareness Month in the US mostly, but then this has also filtered into many countries and globally. And then there's a Mental Health Day in October. There's maternal mental health awareness. There are so many campaigns that are out there that are shedding more light on mental health issues. And that's a positive, and that's something to harp on. We've had many advancements in medicine and science and technology, including the use of artificial intelligence and technology. So this has allowed for more opportunities for virtual visitations and consultation, which can be a significant way to eliminate the barriers to people seeking access to mental health services, because as long as people have access to telephones or Zoom, they can connect to a provider anywhere using telementoring and telehealth visits. So that's one advancement that I want to celebrate. And then also just the mere fact that the world has become a global village. So what is, and COVID showed us that what is a problem in one part of the globe can easily filter to another part of the globe. So at the same time, solutions that have worked in one part can also be adapted within local settings. So again, just that increased awareness and use of those things, it brings me hope. And I think the last message of hope I would want to share is, mental health is so important and is top of the agenda in global health. It's one of the top global health priorities when you talk at the global level. And then even like the World Health Organization and various groups are investing more into mental health, as with private sectors, foundations, and institutions. And lastly, I would like to say, like the World Health Organization and one of my favorite psychiatrists like to say, indeed, there is no health without mental health. So when we think about mental health as a component of overall health, it would get the necessary attention it deserves. And that for me gives me hope. Thank you.
Thank you so much, Dr. Alex Adeomi, for sharing your invaluable insights and expertise with us today. Your words indeed have been able to shed light on the critical importance of maternal child mental health awareness, especially at this critical period where we are celebrating the Mental Health Awareness Month. The need for a comprehensive and a more culturally sensitive approach to addressing this global condition has been emphasized, and also pointing to the fact that prioritizing the support and intervention in this area is critical. I'm sure we have been able to advocate for a world where children receive the care and support that they need to thrive, fostering a healthier and more resilient society for generations to come. And to our dear listeners, thank you so much for joining us. Thank you for listening to us. And until next time, please stay well and keep the sanity drive going.
Same drive, I'm on the same drive. No more doubts, I'm feeling alive. With every mile I leave the past behind.